James A. Henry, The Tinnitus Book, Understanding Tinnitus and What to Do to Find Relief. If you've ever felt trapped by that relentless ringing in your ears, you're not alone. For millions of people, tinnitus isn't just a background noise. It's a daily struggle that can affect sleep, concentration, mood, and overall quality of life. But here's the most important thing to know. You don't have to stay trapped. While tinnitus can feel overwhelming, there is real hope in understanding what's happening behind it and discovering practical, science-based tools to manage it. That's exactly what this Blink is here to offer. We'll guide you through the core knowledge and strategies that can help you feel calmer, more in control, and more connected to your life, even when the ringing doesn't go away. This isn't about miracle cures or empty promises. It's about empowering yourself with the right information and techniques to shift your relationship with tinnitus. We'll start by unpacking the medical and neurological foundations of tinnitus, what causes it, why it persists, and how the brain responds to it. Then we'll move into research-backed methods drawn from psychology, mindfulness, and behavioral science that can help reduce the distress tinnitus causes and increase your resilience. This is your invitation to move beyond simply coping. With the right tools and mindset, you can begin to live fully again, letting tinnitus recede into the background as just one aspect of your experience, no longer something that defines or controls your life. 2 case studies. Let's start things off with a few examples. Imagine waking up one morning to a sound that no one else can hear, a persistent hum or ringing that follows you everywhere, even into your quietest moments. That's exactly what happened to Elizabeth, a hard-working 32-year-old single mom balancing life's constant demands. One morning, she noticed a strange noise. She checked around the house, looked outside, and even unplugged appliances, but the sound didn't stop. That's when she realized the sound was coming from inside her own head. In search of answers, rather than the dubious and often unhelpful information that's online, Elizabeth made an appointment with a local ENT doctor. But instead of finding a solution, she was told what many people with tinnitus hear. There's no cure, and she would need to learn to live with it. It was a moment of heavy reality. But fortunately, Elizabeth kept looking and eventually met an audiologist who explained to her that there were tools that could help her manage the intrusive sound. He introduced her to sound therapy, showing her how different sounds could provide relief when the ringing became too much. He also recommended seeing a psychologist to help her shift how she felt about the sound that wouldn't leave her alone. Through those therapy sessions, Elizabeth learned techniques and found a way to live where tinnitus didn't control her emotions. The sound never fully disappeared, but over time it became less of an overwhelming burden. Then there's Robert, who struggled with both hearing loss and tinnitus. He started using hearing aids, which his audiologist adjusted to a gentle, constant sound, a masker, that made the ringing less noticeable and even soothing at times. Inspired by this small victory, he also started using a bedside sound machine to help him sleep. Gradually, tinnitus became less of a constant intrusion, and he was able to reclaim peace in his daily routine. The point of these examples is to show that there are no universal standards for treating tinnitus. How disruptive tinnitus is will vary from person to person, which means that the right treatment will vary as well. In any case, the important thing to understand is that anyone can claim to be a tinnitus expert, so it's crucial to find a clinician, such as an audiologist, who truly understands tinnitus care and will guide you with clear, evidence-based support. To better understand your own case, in the next section, we'll take a closer look at what causes tinnitus, and then dig deeper into the primary modes of treatment you can pursue. The simple and mysterious nature of tinnitus. What exactly is tinnitus? The simplest definition is that it's a sound that shouldn't be there, but is. It comes from inside the head, and while it's commonly tied to hearing loss and noise exposure, it can happen for many reasons, or sometimes for no clear reason at all. Most cases of tinnitus are classified as primary, meaning the sound is a perception generated by the brain with no external source. Within primary tinnitus, there are several variations. It can be brief and occasional, come and go intermittently, or persist constantly. There's also secondary tinnitus, which comes from physical causes like blood flow issues or muscle spasms and can sometimes be treated by addressing these underlying issues. For the sake of not making things too complicated, we're going to focus on primary tinnitus. Almost everyone has experienced brief ear noise, that sudden, high-pitched tone that pops up out of nowhere and fades within a minute. Totally normal, no need to stress about it. If it lasts longer, like up to a week after a loud concert or a blast of noise, that's temporary ear noise, which is your body waving a red flag, telling you that your ears need a break. Now, if you hear a phantom sound for at least 5 minutes, but it happens less than once a week, that's occasional ear noise. Once it crosses over into happening at least weekly for 5 minutes or more, it officially becomes intermittent tinnitus, which is when we start to consider it a health condition rather than just a random quirk. Constant tinnitus, on the other hand, is there all the time, even in a quiet room. If you're not sure whether yours is constant or intermittent, ask yourself, can I always hear it in silence? If yes, that's constant. One of the most helpful and readily available forms of tinnitus management involves masking, which is simply using background noise to help cover up the tinnitus sound. If you have constant tinnitus, you may have already experienced the benefits of masking by everyday sounds. Driving with the stereo on is often a reliable form of masking. But then, once you're in bed at night, you'll notice that the tinnitus feels louder. That's because the ambient masking is gone, and it's why some people think their tinnitus is intermittent when it's actually constant, but just hidden during the noisy day. Tinnitus can also fluctuate in loudness, pitch, and quality. It might sound like a warbling cricket or like a busy cafeteria where the noise changes constantly. For some, it's a single tone. For others, it's a mix of different sounds like a high-pitched ring plus a low hum. Some people also experience reactive tinnitus, which is when stress or certain sounds or even certain foods and drinks can make tinnitus seem louder. So while the definition of tinnitus is pretty straightforward, everything else about it can be a little mysterious and vary from person to person. Likewise, it's hard to predict what your tinnitus will be like in the future. It might fade, stay the same, or fluctuate over time. One thing is certain: protecting your hearing from loud environments is key to preventing it from getting worse. How we're affected by tinnitus. Before we get any deeper into the kinds of treatments that are available, let's look at a few more case studies to show the variety of ways in which tinnitus can affect people's lives. Because which treatment is best for you will depend on how affected you are. For example, Norman is a 68-year-old Army veteran who's lived with tinnitus for years, but things took a turn when he used a chainsaw without enough ear protection. That one day of loud noise made his tinnitus way louder, to the point where it wrecked his sleep for over a year and drained his energy across every part of his life. Then there's Mary, 37, who got tinnitus from a head injury over a decade ago. She became caught in an exhausting loop. She worried about it getting louder, which made it focus on it more, which made her even more anxious, which made her think about it even more. It's a spiral that's taken over her ability to live normally. And then we have Raquel, 44, a violinist who developed tinnitus after years of playing in an orchestra. It hasn't affected her sleep, but it's messing with her concentration, especially when she's reading, practicing, or working on her computer. So, for some, it's really bothersome, preventing sleep, causing anxiety, and even depression. For others, it's there, but it isn't putting them on edge. Bothersome tinnitus is, in fact, an official term. It means it's affecting your quality of life, causing distress, and making you want to seek help. If you're not feeling that distress, it's considered non-bothersome. How much tinnitus bothers someone depends on a mixture of factors. To start with, If your tinnitus is the result of a traumatic event, like a head injury or an explosion, having it tied to an emotional event like that can make it more distressing. On the other hand, if tinnitus came on gradually during something you loved, like playing in a band or going to concerts, you might not feel as distressed. Personality plays a role too. People who already struggle with anxiety, depression, or insomnia may find tinnitus more bothersome. As a side note, tinnitus can also cause these issues, so it's a tricky chicken and egg situation that makes it a hard area to diagnose. But at the end of the day, lifestyle factors like healthy sleep, exercise, managing stress, and staying socially active can reduce how much tinnitus bothers you. And enriching your environment with comfortable, low-level sounds can help train your brain to tune out that phantom noise. In the next section, we'll start to look at more of the solutions that are available to you. What approach is right for you? By now, you hopefully have a clearer sense of just how varied tinnitus can be, and how it first shows up, and how it impacts daily life. So let's turn to the next important question. What actually happens when you seek medical help for tinnitus, and what steps can you take to manage it effectively? When you go to see a professional, the aim is going to be to help you eventually self-manage your tinnitus, but the journey usually starts with an evaluation. This will assess the severity of your case, check if other issues are present, and establish a baseline in order to see how you respond to treatment. Research shows that around 90% of people with tinnitus also experience hearing loss, so getting your hearing checked by an audiologist is crucial. They'll do tests like pure tone audiometry and speech audiometry to see how your hearing's doing, which helps shape the best plan for your tinnitus. When it comes to treatment, there are a lot of options these days. There are hearing aids with Bluetooth streaming, which incorporate different sounds to soothe, distract, or fade out your tinnitus during the day. One patient, Claudia, found these to be a great benefit, and at night, she switched to sleep buds and found that listening to audiobooks helped her doze off by keeping her mind off the tinnitus. Other people might find it more difficult to tune out or mask the sound of their tinnitus. In these cases, there may be a need for a more prolonged, therapeutic approach. For this, there are multiple options, and we'll look at 4 of the main ones. These are cognitive behavioral therapy, or CBT, tinnitus retraining therapy, or TRT, tinnitus activities treatment, or TAT, and finally, progressive tinnitus management, or PTM. In the next and final section, we'll explore some of the key treatment options in more detail. While each approach differs, they all share a common goal: helping you reach a state of habituation, where your brain learns to tune out the sound of tinnitus so it no longer triggers stress, disrupts sleep, or causes constant frustration. There's a wide range of treatments available, from acupuncture to various sound therapies. None offer a guaranteed quick fix, but many can be effective, especially when combined with self-care strategies that support better sleep, improved focus, and a healthier emotional response. The bottom line is that success with tinnitus management often comes down to having a knowledgeable clinician and your own commitment to following through, learning, and experimenting to find what helps you personally. 4 proven treatments. In this final section, let's take a look at 4 research-backed treatment methods that you can start using if you're living with tinnitus on a daily basis. While these approaches aren't miracle cures, they offer practical, structured ways to manage your symptoms and take meaningful steps toward reclaiming your quality of life. The first one is a treatment you've probably heard of: cognitive behavioral therapy. CBT is all about changing the way you think about tinnitus so you can change the way you feel about it, and, ultimately, how much it impacts you. It involves learning relaxation exercises to manage stress, getting back into activities you enjoy to help shift your focus away from the ringing, and enriching your sound environment to soften the noise. You'll also work on tackling negative thoughts about tinnitus, replacing them with more constructive ones, which can lead to a real shift in how you experience it day to day. Next is tinnitus retraining therapy. TRT's main goal is for you to be barely aware of your tinnitus, letting it fade into the background so it no longer rules your life. It uses structured counseling based on how the brain processes tinnitus, along with sound therapy, to promote habituation and getting to a place where your brain learns to stop reacting to the sound. TRT often uses wearable sound generators, or hearing aids with built-in sound generators, to help mask the tinnitus. And you're encouraged to keep a low-level, comfortable background sound going, even while you sleep, to train your brain to ignore the tinnitus. The third method is tinnitus activities treatment. TAT is a holistic approach that uses counseling, coping strategies, as well as optional sound therapy. It helps you build a positive outlook, teaches you how to reframe tinnitus as an unimportant sound, and encourages you to stay engaged in hobbies and activities that shift your attention away from it. Patients sometimes use a tinnitus diary to track how they respond to sounds and situations, which can guide adjustments to your environment or activities to reduce tinnitus prominence. It also covers improving sleep and communication, especially if you have hearing loss alongside tinnitus. Finally, there's progressive tinnitus management. PTM is known as a stepped care approach, and it's one that the author has helped develop. Stepped care means you progress through different levels of treatment based on your personal needs, starting with basic education and self-help, and moving to higher levels of professional care only if needed. This ensures you get exactly the level of support you need, without overcomplicating treatment. Now, finding experienced providers for these methods can be tough, so it's recommended that you do some research and learn as much as you can about each approach to find the one that seems best suited to your own individual needs. Whatever you choose, these are all proven, practical tools that can help you manage tinnitus, whether it's reframing your thoughts with CBT, retraining your brain with TRT, taking a holistic approach with TAT, or moving through the structured steps of PTM. There's a clear path toward tuning out the noise and taking back control. The main takeaway of this blink to The Tinnitus Book by James A. Henry is that tinnitus, that persistent ringing or buzzing in the ears, can have a real impact on daily life, but it doesn't have to control it. While there's no universal cure, there are proven ways to manage tinnitus and reclaim a sense of normalcy. The key lies in understanding what tinnitus is, what causes it, and how it affects your thoughts, emotions, and focus. From there, you can find the right treatment that suits your needs, whether it's cognitive behavioral therapy, tinnitus retraining therapy, tinnitus activities treatment, or progressive tinnitus management. These primary treatments are meant to get you to a place of habituation, where your brain learns to tune out tinnitus so it is no longer bothersome. These treatments often use a mixture of behavioral therapy and sound therapy to retrain your responses to the sound and help mask the sound to make it less disruptive. Learning about these methods and practicing self-care skills can help you live well, even with persistent tinnitus, empowering you to take back control of your life. Okay, that's it for this blink. We hope you enjoyed it. If you can, please take the time to leave us a rating. We always appreciate your feedback. See you in the next blink.